everyone, welcome back to my channel. As you can see, I have recently moved house, so I have a new background which I'm very excited about, and my own room to put all my stuff in. So that is why you've got no backdrop now, which is awesome. I'm really excited about that. As you can probably tell from the title, this is finally a follow-up video regarding my surgery that I had in April. So it's going to be a bit of a Q&A, frequently asked questions type of video that I can refer people to just to help people out if they were considering having surgery, or, you know, even if you're just curious. Since having my surgery, I've gotten heaps of inboxes, lots of people asking me lots of different things about my surgery, and I found myself answering a lot of the same questions over and over. So I'm really hoping that in this video I can answer a lot of the more commonly asked questions all at one time, and then yeah, just get it all cleared up, I guess. If I forget anything, I do apologise. I'm hoping that I can include everything, but you know, I'm sure some things will probably slip through the cracks. You're welcome to inbox me on Instagram. I usually link my Instagram down below, and you can just ask me whatever I didn't answer in this video. So I did ask on Instagram. I made a post, just what do you want me to talk about, and I had a few people answer to that, so I'll cover those questions in this video as well. Without any further ado, I guess we will get into answering some questions. So the best place to start would probably be where and by whom and all that sort of jazz. I have got a few other videos in this series where I did talk about more in depth before my surgery why I was going ahead with it. But for the sake of this video, I had my surgery done through the company COSMEDITOUR at the World Medical Center in Bangkok, Thailand by Dr. Montian. And overall, just to cut to the chase nice and early, I was extremely happy with my experience. It was honestly, it was amazing. I look back on my surgical experience very fondly. It was perfect. I don't think it could have gone any better. But I'm pretty easygoing, so. So I had my surgery at the World Medical Center in Bangkok, Thailand by Dr. Montian. I had a rhinoplasty done and a breast augmentation, procedures I've been thinking about having done for a little while now, and you can check out further information as to why I went ahead with my surgery if you're curious in one of my previous videos. So my surgery altogether cost around the $13,000 mark, including warranties and things like that, and that was to have both procedures done at the same time. So I was pretty happy with that price. Yeah, I don't know, it'll probably, prices will vary depending on your case, your surgeon. There's a lot of different factors. So, but just for, you know, since a couple of people have asked me, that's what it cost. I got the rhinoplasty package, and then I paid for my breast augmentation procedure only on top of that. And then there were some warranties and other fees involved. Now, the rhinoplasty package that I got at the time is a little bit cheaper than the one than what is on offer now through COSMEDITOUR. I think just with conversion rates and surgeons' fees and that sort of thing, prices have just gone up, and that's just the way life is, I guess. So now with my breast augmentation, I went with, let me remember this, I went with 275 cc's and 325 cc's, left and right respectively, because one was bigger than the other, as most ladies have, and I went round, silicone, under the muscle. Now the reason why I chose under the muscle as opposed to over is I just really preferred that more naturalish look. I didn't want to have too much obvious upper pole, I just wanted the edges to be a little bit softer, and from my own research, which I did extensively, it just seemed like under the muscle was the better option for me. When I asked Dr. Montian what he thought, he said that I could do either, whichever one I preferred, and both would work fine. So I just went with under the muscle. That's what my gut told me. That's what my research had shown me. So that's just what I went with. There are pros and cons to going under or over with both of them, and it's just up to you to work out what you want, and which will give you that result. Over the muscle is typically for girls that have a little bit of breast tissue to hide the implant, and maybe for a bit more of an augmented look. But then again, different surgeons will say different things, and it's best to listen to your surgeon after you tell him what it is that you want, because after all, he's the expert. So. And another thing with my implants is they are smooth, so you can get textured or smooth. When I went into my consult with Dr. Montian, I hadn't made up my mind or had any preference to smooth or textured personally before I went in. I think I was thinking more textured for whatever reason, but when I went in, Dr. Montian said that he prefers to use smooth for under the muscle and textured for over the muscle, and to be honest, it didn't matter to me to argue with that or ask him why. I just thought, well, you know, if that's what you prefer to do, then I trust you, you know. So that's what I went with. Now I am nearly 10 weeks post-op, which is crazy. It feels like it's just gone in a blink of an eye, which I knew it would. I've, in the meantime, post-operatively been like massaging my breasts as my surgeon has shown me, and I also had to do massages on my nose and apply tape at night to help with swelling and keeping the lump from reappearing, because as Dr. Montian said, your nose and any part of your body really has a bit of a memory and will try to go back to the way it was before. So if you're not careful with your post-operative care, then you may find your hump reappearing, or in my case, my nose was really badly crooked. I might find my nose will swing back over to the right side of my face. So I was really good at keeping up with that and making sure I wasn't slack. So after I got back from Thailand, I had to flush my nose twice a day with normal saline. And I believe that was just to sort of keep it clear, and it was actually really helpful because for the first 6 weeks you're not allowed to blow your nose hard, or you have to avoid it, like with knocks and things like that. I wasn't allowed to wear my glasses, so it's a bit delicate, and when you can't blow your nose, you feel very stuffy, and I think that's even worse when you know you can't blow your nose. You just think, oh my god, my nose is so stuffy. So the flushes are actually really helpful in just cleaning out and making that a little bit more comfortable. Back to my breasts. So I have gone from a 10B to I'm currently a 10 double D, which is awesome because that is the size that I was crossing my fingers for. I was really worried that if I ended up like an E or something, because it's really difficult to find bras in that size. Double D I've found so far not too much trouble finding bras in my size, which is just such a relief. So I'm really happy with that, but they will still continue to change, and you never know, might end up bigger, smaller, who knows. But at the moment, they're settling really well, so I'm really happy with that. So now I'm going to get into some of the Instagram questions. I don't really have a particular order for this, and I have read them, but I haven't memorized them, obviously. So I might repeat myself a little bit, hopefully not, but we'll just bumble along. So the first question from Wargasm97 is, what bra size were you before? What do you end up with after surgery? What size and type of implants did you go with, and why? I think I've already talked about that. Size and type of implants. I suppose I didn't mention that they're Mentor implants. You can get different brands, but I'm pretty sure, I'm not sure, I didn't really ask Dr. Montian if he uses other brands, but I was pretty happy with Mentor anyway. So I'm supposed to address the why of that question. So when you're looking at having a breast augmentation done, you've got silicone implants and you've got saline implants. Now, there are pros and cons to each, of course. The biggest thing that is a pro, I guess, to choosing saline is that if you get a rupture, you'll know about it straight away. The saline that leaks will be absorbed by your body and your boob will kind of deflate, as far as I'm aware. Now, if you are looking at silicone, silicone is said to have a more natural feel than saline. Personally, I haven't stood there feeling both, but that's just what I found through my own research, that silicone felt more natural. But the con, obviously, is that if you get a rupture, it's not always immediately evident, and that it is recommended in some places in the world to get MRIs to check for ruptures. Now, implants nowadays are made incredibly durable, obviously. They're a lot better than they have been in the past. And to get a rupture, you'd have to have some sort of severe trauma. So just personal preference. It's more, for me, it came down to peace of mind if you have a rupture, or, you know, if that's not really a worry to you, if you trust your implants and your brand, then choosing for the feel. So for me, I really wanted that natural feel, and through watching videos of implants being tested and things, I wasn't concerned that a rupture would cause me a problem. So next question is Melbourne. Are you planning on having other surgeries? No, I don't have anything else at this point in my life that I want to get done. It was for my childhood and my adolescence, always my nose, and crossing my fingers that my boobs grew bigger, which didn't happen. So when I think about it, there's nothing else that even remotely crosses my mind. I mean, I thought that maybe when I got older, I would be open to like a facelift or something like that. But I mean, I'm in my 20s, that's years away. But not at this stage, unless you count lip injections. So Careless X Baby has asked me, I've been looking at getting a nose job and boob job at the same time as well with COSMEDITOUR, comparing the healing process together, which one was worse and why? So probably not surprisingly, I would say the nose, the rhinoplasty, was a tougher recovery process if I had to pick one, because realistically, I didn't have trouble with either of them. I didn't really have trouble with my recovery at all. On the whole, I found it a lot more pain-free than I was expecting. Then again, I did really keep up with my codeine. I work on a surgical ward, and it's just, there's no need to be a hero. If you've had surgery, have some pain relief. You know, who wants to be in pain, right? So for the first 2 or 3 days, I had probably 2 or 3 doses of my codeine tablets that I was discharged with a day, until I started to feel really nauseous on my 3rd or 4th day, and then I stopped the codeine just to see how I went, and I didn't really have any more pain than I did before, so I didn't feel the need to take any more after that. So it might have been because I kept my codeine up, or I was just lucky. But back to the question. The reason why my nose was probably worse than my boobs is because I had a bit of a dull ache, and I was constantly worrying about knocking my nose, rolling on my face, and just the anxiety associated with it. With my boobs, I just sort of had a bit of trouble getting in and out of bed for the first day or two, but other than that, not really any pain. They weren't really sore. They just sort of did their own thing while I fussed over my nose, so yeah. Foxtrot Shot, where were your incisions placed and what have you used to fade them? So my incisions are in the breast fold, so underneath my breasts, and they're probably about 1.5 inches or so. They're really quite small. It amazes me they managed to get implants through that hole. But I chose to have them there because through my own research, again, you can have breast fold through the nipple or axilla, so they go through the armpit or the belly button, I think, in some places, but that wasn't offered in Thailand, as far as I'm aware. I didn't ask. So through my own research, I decided with the breast fold because it offered the best visibility for the surgeon to create the pocket. And to me, it was more important that the surgeon could see what he was doing than a bit of scarring. And obviously with my situation, I'm not particularly private, or obviously I'm not particularly shy about the fact that I had a breast augmentation. I'm more than happy to say, yeah, I had my boobs done, you know, what of it. So to have some scars, like, I wasn't trying to hide anything. So if you get them through the nipple, there is an increased chance of infection from my own research. Not saying that you shouldn't get these other incisions done, but this is just why I chose my incision placement. But anyway, there was research to suggest that nipple incisions had an increased infection rate because you're going through or around the mammary glands, which have milk ducts, which contain bacteria, or something along those lines. And I think there has been there's a bigger chance, or a more increased chance, of having issues breastfeeding later. Again, this doesn't mean that everyone who has it done is not going to be able to breastfeed or is going to get an infection. It didn't mean enough to me to have a scar, to be without a scar and go nipple, to choose that and take the risk, if that makes sense. So with every decision you make, you've got to weigh up the risks and the possible consequences and that sort of thing. And to me, having the increased risk of infection and not being able to breastfeed and that sort of thing just wasn't worth not having a visible scar. So I went with the breast fold. What have you been using to fade them? So I started off using some rosehip oil, and literally just a couple of days ago I ordered a Stratoderm silicone gel, which has become highly recommended to fade like surgical scars and keloid scars and all sorts. So I have to use that once a day, and I think I've got 90 days worth. So I took some pre-photos of just the incisions, and after I finish the tube, I plan on taking some after shots, so that I might be able to maybe post on Instagram how it went. So Billosaurus has asked, how many and what kind of new pink things did you buy with the change in sizes? I don't really think I've bought anything pink. Most lingerie companies make stuff in black and red, and I bought a lovely beige t-shirt bra. That's not padded, but I don't actually think I've bought anything pink. It's kind of sad. I might have to change that. Sarah Wants Boobies 2017 has asked, how long did you have to sleep sitting up or on your back? I think not sleeping on my side or tummy is going to be the worst for me. I was so not looking forward to having to sleep upright, because I am a side sleeper and I sleep sort of on my stomach, like in the fetal position almost. But I actually didn't find it too bad. Again, it's difficult to say for sure, because with my situation, I was discharged from the hospital in Thailand with sleeping tablets, and my nursing background told me not to be a hero. You need to sleep, so I just took them, I think, every night for the first 5 or 6 nights, and had a beautiful 8-hour sleep sitting propped up on like 4 or 5 pillows. I woke up like Sleeping Beauty the next day, but I feel like that's probably because of the tablets. So after that, when I came home, I had to sleep on my back for 3 weeks. I didn't actually ask the surgeon, I don't think, how long I had to sleep on my back for, but I got given post-op instructions, and I think it was for my breasts. I had to sleep on my back. It said 2 pillows, but I sort of slept on like 3 at like a 30-degree angle, 3 or 4, just to keep myself upright. So that was for the first 3 weeks post-op. It did get really old, but when I started to try sleeping on my side like the day after or the day of my 3 weeks post-op, and found that it was very uncomfortable. I felt really sore, so I slept on my back again, and it wasn't until I could lay on my side and feel comfortable that I did that. I just didn't push my body. Your body will tell you what's okay and what's not. I've seen some girls that have been able to sleep on their side and their tummy like a week post-op, and they said they felt fine, no pain, it felt great. So I guess it just depends. Just listen to what your body's telling you. If it's uncomfortable and it's painful, your body's probably not happy with that. So Hayley Bell asked, how much was the breast augmentation alone? I'm really curious about the price. I just don't know where to start. So that's a bit of a hard question for me, because I had the combo. But for the sake of the question, the breast augmentation alone was about $4,000 Australian. However, that was procedure only. It didn't include a whole lot of stuff like my accommodation in the package. It didn't include numerous other things, because I was already going to be under anaesthetic having my nose done. So it was just a matter of the time of the surgeon and the implants, I guess. So I think COSMEDITOUR, when they offer breast augmentation packages, they're a little bit more than $4,000, because mine was just like an add-on. So So next question is from Abba Devitt. What type of items helped you out? What dose did the hospital supply you with, etc.? Food, showers, bra, medication. How was COSMEDITOUR and how'd they help? Sorry. So items that helped me out. So I was recommended through the forums that I watched and everything like that to take like thrush medication and aperients, which are like laxatives. And the laxatives were very helpful. As I mentioned before, I wasn't shy in taking my codeine to make sure I was pain-free, and that plus being post-op, a common problem is not having much activity with your bowels. I struck that kind of problem, and I took some Coloxyl Center with me. It was very helpful, just to relieve a bit of the discomfort associated with that. What else? So they gave me ice packs when I went home, but bringing ice packs would be a good idea. I've seen that a lot of girls found that ice packs were really helpful on their breasts and things like that. Mine was really good for my head because of my facial swelling post-op. I was blown up like a balloon. I felt awful. The ice packs really helped to sleep on my head. It was just so comfortable. In terms of bras, I bought Kmart bras and I bought Burlay post-op bras. So the Kmart bras are ones that zip up at the front, and the Burlay bras are just a standard Burlay post-op bra. I ended up living, and still kind of am a little bit, in my Kmart zip-up crops. They were extremely helpful. I wore them to bed, I wore them out, so they were just really, really great. The Burlay bras were a bit tight and a bit thicker, so they did provide a good amount of support, and I lived in the Burlay bras sort of during the day from about 1 week post-op to maybe like 5 or 6 weeks post-op when I started to move to normal bras. How was COSMEDITOUR and how did they help? So COSMEDITOUR were amazing. When I was first looking into it, it was more of like an inquiry type of deal. I wasn't convinced I was going to have surgery. I was like, oh, I'm just looking into it, you know, I'll just see what the prices are and that sort of thing. Had a girl ring me after I made the inquiry form, said like, you know, like what's going on? Like, how can I help you out? And she was super friendly, super helpful. I said, you know, like, what's the deal? Could I have both done at the same time? Which was a big concern of mine. She said, oh, we'll just ask the surgeon. If I had any questions, I just emailed someone. I think I emailed one of the poor reps like 4 times in a row because I asked a question, then found the answer, then needed another question, then found the answer again, and she just replied, like, I think she must have just been laughing her pants off back in her office. She was just like, it's fine, because I said, I'm so sorry, I've just emailed you so many times, I completely get it now. And she was just like, it's completely fine, like, smiley face. So they were super friendly and super helpful when I needed it. I did a lot of my own research, so I didn't bombard them a great deal with too many questions. Because I just looked into it myself. They add you, when you go through COSMEDITOUR, they add you to a COSMEDITOUR forum for all the girls who have gone to Thailand, are going to Thailand to have surgery and have paid their deposit. So it's a closed forum. You can only be added to it when you have paid your deposit. And that was awesome. You could see what your hotel looks like. You've got girls posting about the hospital, their experiences. You can just ask, say, hey, girls have had their boobs done, like, what's the deal with this? And you've got first-hand accounts to answer your questions. So, and all the girls on there are super lovely and supportive and amazing. So I love forums like that. It's a real like friendly place to be in. So. When I came back from my surgery, or even while I was, so let's rewind, the week post-op when I was still in Thailand, the COSMEDITOUR reps that were down in the lobby of my hotel, they rang my room if I didn't come down for the day and said, how are you feeling? Is there anything we can do for you? That was Swang and Fern, and they were beautiful girls. And when I did want to go out, they called me a taxi. They wouldn't let me carry any bags or anything like that. They took them off me all the time. And they just sat with me, chatted with me, said, how are you doing? Is there anything we can do? They were just, they couldn't help enough. It was really nice. And when I got back, I think I've had maybe 2 phone calls just to check, see how I'm doing, how my post-op recovery is going, which for me has been a breeze. So I was always like, yep, I'm fine. You don't have to worry about me. And I've gotten numerous emails like saying, how are the photos going? You know, because they always want to see, you know, before and after. Of course, if you're not into that, I'm sure that they understand. So the last question I have here is from Lizzie Rascal, and it is, can you talk from a professional point of view the differences between Thai and Australian health standards? So this is probably the hardest question, I guess. From what I could see, the Thai hospital, the World Medical Centre that I stayed in, was impeccably clean. It just felt so sterile and felt very, just felt clean. From that point of view, that was awesome. The nurses, I didn't watch them like a hawk or anything like that. I didn't want to be that guy. But from what I could see, had really good hand hygiene. So they washed or gelled their hands before they did anything. Used gloves before they put my IV in. They swabbed my IV before they connected me to anything. So just the basics of infection control were there, which was really comforting to know. Now, I think that's all I've got to talk about in this video. I don't have any other questions or anything like that. So for now, for the end of the video, it's just more or less, I'm just going to show you what my boobs look like, I guess. I'll just put like a little bikini on. But I mean, obviously for my nose, you can see what it looks like. So I don't really have much to say on that. It's now pretty straight. And I don't have a significant dorsal hump or anything like that. So I'm super happy with that. So this is what my breasts are looking like now at nearly 10 weeks post-op. I posted a photo wearing this bikini about 2 days post-op or so, which is on my Instagram as well. And at the time they were still really high and round, obviously, because I was only 2 days post-op or whatever. So they've settled down quite a lot, and I'm really liking how they're looking. I think they look really good, and I think they're a really good size for my body. I think they're very proportionate. I don't think they're too big or anything like that. All in all, I'm actually really quite happy. So I think that's probably about all I've got to talk about in this video. So, I mean, if there are any other questions, feel free to leave a comment. I'll try to answer them as best I can. Otherwise, I've posted other photos post-op on my Instagram, which I always link down below if you wanted to see further photos and things like that. But yeah, all in all, my experience was really quite good, and I'm super happy. So I hope this helps anyone out who's thinking of doing the same thing. So thank you for watching. Don't forget to like and subscribe, and I'll try to, I might do another update, but I'll see how I go. It did take me ages to bring this one out, so might not push our luck, we'll see. But anyway, thank you for watching. Bye.